Do sex or pregnancy really cure fibroids? The truth many doctors don't explain. There's a common advice many women receive when they are diagnosed with fibroids. Some doctors say, just get pregnant. And others may say, once you start having sex regularly, the fibroids will go down. But the big question is this: is that actually medically true? Can sex prevent fibroids? Can pregnancy shrink fibroids? Or is this one of those medical beliefs that people have repeated for years without understanding the science behind it? In this video, we are going to break down the truth about fibroids, pregnancy, and sex based on medical research and what doctors actually know today. If you're a woman dealing with fibroids or you know someone who is, this video may clear up a lot of confusion. First, what exactly are fibroids? Fibroids are non-cancerous growths that develop in the muscle wall of the uterus. That is the muscle wall of the womb. They are extremely common. So if you have one now, don't panic. You are not alone. In fact, studies show that up to 70 to 80% of women will develop fibroids at some point in their lives. Yes, especially between the ages of 30 and 50. Some women right now never even know that they have fibroids because there are no symptoms. But others, fibroids may cause them signs and symptoms. Particularly, some may have heavy menstrual bleeding, severe menstrual pain, frequent urination, pelvic pressure, abdominal swelling. Sometimes it looks like they are pregnant, and then difficulty getting pregnant. Some fibroids can range from completely harmless to very disruptive, problem, depending on the size and location. Now, the question is, why do fibroids grow? To understand the pregnancy question, we must first understand what causes fibroids to grow. Fibroids are strongly influenced by hormones, especially two major hormones like the estrogen and progesterone. These hormones stimulate the uterine tissue, and fibroids grow from that same tissue. That means anything that significantly increases these hormones can sometimes make fibroids grow faster. Now, this brings us to the pregnancy question. Does pregnancy shrink fibroids? This is where many people misunderstand the situation. During pregnancy, the body produces very high levels of these hormones I mentioned, that is estrogen and progesterone. Because of this, many fibroids actually grow larger during early pregnancy, especially within the first trimester, that is the first 3 months of the pregnancy. Some women with fibroids even experience pain during pregnancy because the fibroids are expanding largely or rapidly. But something interesting often happens after the baby is born. When pregnancy ends, hormones levels will drop significantly. The uterus will shrink back to its normal size. Because of this process, you know, many fibroids will reduce in size after childbirth. Take note of this. That is what makes some people think that, pregnancy reduces or cures fibroid. Some medical studies have shown that about 70% of fibroids shrink after pregnancy. Are you with me? And some may even disappear within a few months. This is where the confusion is. This is what deceives people into thinking that pregnancy cures fibroid. However, and this is very important information, this does not happen in every case. That is, it doesn't happen in every woman. Some fibroids remain the same after childbirth. Some may even grow larger later. So pregnancy is not a guaranteed treatment for fibroids. Take note of that. Now, the next question is, does sex reduce fibroids? This is another belief that needs clarification. There is no scientific evidence that sexual activity reduces or prevents fibroid. Sex does not significantly change the hormonal environment that controls fibroid growth. So, regular sex does not shrink fibroids. When, in some cases, when doctors encourage women with fibroids to have sex, it is actually because they want the women to try to conceive before fibroids grow larger, not because sex will cure the fibroids. The only thing is that many doctors don't explain this clearly. They just tell you, have sex, and it will take care of it. Sex doesn't. Most of them who don't explain this clearly to you are only encouraging you to have your child or children before the fibroid grows larger. Do you understand that? Unfortunately, many people misunderstand this, or the doctors don't clearly explain this to them. Now, once again, why do doctors suggest pregnancy at times? Sometimes doctors suggest that women who want children should not delay pregnancy too long if fibroids are present. The reason is simple. For those doctors who genuinely give such advice, who have no ulterior motives, the real simple reason is this: fibroids tend to grow over time. So if a woman plans to have children in the future, doctors may advise her to try earlier than later. But this is very different from saying pregnancy cures fibroids. It does not. Pregnancy is not a treatment. It is simply a life event that sometimes changes fibroid size afterward, which I've told you that is not in every case. How about the risk involved in getting pregnant in the presence of fibroids? Yes. Another thing many people don't talk about is that fibroids can sometimes complicate pregnancy. Depending on the size and location of the fibroids can increase the risks of miscarriage, premature birth, abnormal baby position, like breech, transverse, and so on. Then it can also lead to cesarean delivery. However, many women with fibroids still have completely healthy pregnancies and deliver safely, either vaginally or through CS. It just requires proper monitoring by a doctor. Now, what are the real-time treatments for fibroids? Since pregnancy and regular sex don't cure fibroid, what is the real cure for fibroids? if fibroids are causing serious symptoms. Like I said, some of them have no symptoms. But if they are causing serious symptoms, doctors usually recommend medical treatment rather than relying on sex or pregnancy. And treatment options may vary. They include medications that control hormonal levels. Like I explained before, anything that can reduce the hormones like estrogen and progesterone, or testosterone rather, it can reduce the size of a fibroid. Do you get that point? So medications that control hormone levels can help. Then procedures that block blood flow to the fibroids can also make them to shrink, because if blood supply is reduced or cut off from the fibroids, they start shrinking. The blood makes them to grow. Do you get that point? Now, and finally, surgical removal of the fibroids. A procedure called myomectomy. And in severe cases, removal of the uterus, something called hysterectomy, is also recommended or carried out or done. Now, the right treatment depends on what? The woman's age, her symptoms, the size of the fibroids, and whether she still wants children, because you can't remove the uterus of a woman who still wants to have children. Now, finally, on this point, let me summarize the truth. Sex does not shrink fibroids. Pregnancy may sometimes lead to fibroids shrinking after birth, but it is not guaranteed. And pregnancy itself can sometimes make fibroids grow temporarily. That means getting pregnant should never be seen as a treatment for fibroids. If you have fibroids, the best step is to consult a qualified doctor and discuss the safest options for your specific situation. If you found this video helpful, please like and share the video. There are many women suffering silently with fibroids because of misinformation. And if you are new here, this is Made to Last TV, where we talk about relationships, marriage, and the real issues affecting men and women today. Please subscribe to the channel and turn on notifications so you don't miss our next video.